I come from one of the poorest regions. Savannah region was carved out from the northern region, and we lack so many amenities. And we have two major rivers, the white water and the black water, passing through our constituency. And because of that, access to the rural communities are terribly difficult when it is time for, especially the rainy season. But we have a cash crop, that is the share nut. That is the wealth of the constituency, and that is what many of the women engage in. Fortunately for us, we have one big enemy, and that enemy is snake. There are a lot of snakes in that constituency because we feed on the nut. As soon as it drops from the tree, we feed on the nut. We also feed on the lizards, the frogs, and the crickets that come there. And our women, they are all victims of snake bites. An average of 100 women were saved as a result of Zipline facility. So clap hands for Zipline. At least I have lost 100 votes for their family intervention. So this occasion, that's why I keep earlier than before, at least 1 hour in advance, to appreciate the kind of system we have here. So thank you very much. I am filled with immense pride and gratitude as we celebrate a remarkable milestone in our nation's history. We are gathered here to commemorate the 4th anniversary of the groundbreaking partnership between the government of Ghana and Zipline, a partnership that has revolutionized healthcare delivery through drone technology. 4 years ago, we embarked on a journey with the bold vision to ensure timely access to life-saving medical supplies for every Ghanaian, regardless of their geographical location. Today, we can proudly declare that this vision has become a reality thanks to the foresight of His Excellency, the President, for making this a reality. The partnership between Zipline and Government of Ghana has been a shining example of what can be achieved when the public and private sector join forces with a common purpose. Together we have created a seamless network of road delivery services that have overcome geographical barriers, reduced time delivery, and save continuous countless lives. Through this process, we have made Ghana a global leader in the use of drones for medical logistics. Even the US president, she will come for us because we are the first. Zipline drones have flown hundreds of miles over the last 4 years, bringing blood, vaccinations, and crucial medication to isolated villages throughout the country. Example is my constituency, Makalo constituency. As a consequence of these bold measures, we have seen directly how lives have been saved and healthcare outcomes have improved. Infants who were formerly at danger of dying from preventable infections are now flourishing. And mommies who face the life-threatening difficulty during delivery are getting emergency medical treatment without being referred to other facilities on the grounds of non-availability of medical products. As a government-supported ministry, we are poised to continue to create an enabling environment for Zipline to function while automating standard operating procedures to be more focused at underserved operations. First is to work with the companies to navigate any challenges they might have in the course of their operations, and also conclude on revision of the current standard operating procedures. At the stakeholders meeting organized earlier this year by Zipline and the Ghana Health Service to evaluate the impact of this partnership, the Minister of Health was astounded that the statistics that highlighted the number of lives saved and the health disparities addressed with these initiatives in healthcare using drone technology. It is these results that have spurred us to trust Zipline as a global partner for this kind of service.
Honorable Deputy Minister Mahama Asesedi, Zipline leadership and staff, leadership of the Ministry of Health and the National Health Insurance Scheme, honorable traditional authorities and elders, members of the clergy, members of the press, friends. It really is an honor to be here. I have been, as our Director of Program said, dazzled by the work that young people are doing at Zipline. I'm feeling a little old and stupid as I look around in wonder at what you've been able to achieve. And as the minister started, I also would like to start by reflecting on the impact that you've had on ordinary people's lives. We can look at the pictures and we can talk about, the obstetrician needed blood, but that means that mother is around to look after her family. And it's because of something that a drone and this very talented team right here were able to achieve. I think none of us imagined the COVID vaccine or the COVID pandemic when Zipline was being founded. And the tremendous impact you made in getting those vaccines out to people so that they could resume their ordinary lives is enormous and has huge impact on our economies and on Ghana's economic development going forward. So when we talk about partnership for impact or impactful partnership, I've seen it for myself today. It really is something.
When it comes to technology, adoption is quite slow everywhere in the world. Fortunately for us, we were able to work in partnership with the government and other stakeholders and also with our community stakeholders, and that really helped reduce the burden of early adoption, and that has also helped catapult us into where we are today. We currently have learned lessons from our community engagement where we work closely with the communities that we work from. That's also helped us leverage on our technology to expand into other areas, even beyond Ghana. So in terms of diversification, we're currently exploring other avenues such as agriculture. So we are looking at vaccination. We currently are doing vaccination in humans. We are looking to do vaccination in animals as well. So we are currently working with the Veterinary Services Directorate in a pilot to explore the possibilities of vaccination for poultry, for example, ruminants and other things. We're also exploring the possibility of artificial insemination for pig production in Ghana. So these are avenues that we're looking at. There's also opportunity to look into other delivery models, support other services logistically, so postal services, what have you. So these are all avenues that we're exploring. Generally, the challenges has been what I did mention earlier on, which has to do with adoption to technology and the fact that it's something new that has not been seen anywhere else. The questions about whether it really will work or not, now it's all for us to see that it's really working. I think it's more to do with the resilience of our team members and also the great partnership that we have with the Ministry of Health, which has allowed us to pilot some of our technologies around. And then also the communities that we work with, integrating very well into the communities, working with the communities at grassroots level to be able to understand their peculiar needs and challenges, and also picking the learning from there to influence our decision making and also our operation. We currently do more of our deliveries in the countryside. We're looking at bringing it home deliveries, pharmacies, the city deliveries, which is more or less going to disrupt a lot of the industry and the logistics supply that we have. Our mantra is to ensure that nobody is taking out of logistics conversation because of their location or whatever, but we want to make sure that everywhere, irrespective of wherever you live, can have access to valuable logistics. And so wherever you are, whatever you need, you request, you should be able to get it even at the comfort of your home or your offices.